Dr. Nour El Hoda Ezzeddine. She is pharmacist and IBCLC. Please, Dr. Nour El Hoda, welcome. We can't hear your voice, Dr. Nour El Hoda. No, you are not audible.
Test. Can you hear me? Okay. Can you just allow me to share my screen so I can put the presentation, please? Okay, great. So breastfeeding is something I'm really passionate about, and this is why I chose to become a lactation consultant. And today I hope that after this presentation, women would feel more empowered to take the decision to breastfeed, and they would really trust their milk. So major health organizations like the UNICEF talk a lot about the first 1,000 days of life and how important this is. And this is actually because the first 1,000 days of life, and this is the combination of the 270 days of pregnancy with the first 2 years of life, they really make the foundation for everything related to health, growth, and neurodevelopment for the baby. And they will set the foundation for his whole life, and they will impact his whole life, not just his childhood. And this is why we pay a very special attention to nutrition during these days. And since breast milk is the optimal source of nutrition for babies, the World Health Organization recommends breastfeeding exclusively for the first 6 months of life and to continue to breastfeed for up to 2 years and beyond. So they technically cover the whole 1,000 days. And breast milk is really not just about nutrition. So it's not just about fulfilling basic nutritional needs. It's really a nurturing relationship. It's about bonding. It's about responding to baby and attending to his needs. So if we're going to talk about the nutritious part, this is just a visual to compare breast milk to formula and to see how much components exist in breast milk but are not present in formula. Yet formula is judged to be to meet the basic nutritional needs for babies and for young children. But you can see that breast milk has a lot more. It has growth hormones, enzymes. It's also alive. It has antibodies. It has stem cells. So it's really perfect for babies' development, and it promotes his health. So just by seeing this picture, you can imagine how much benefits breastfeeding offers. So it's ready. It doesn't need to be heated, doesn't need to be sterilized. It's customized according to baby's needs. And of course, it's environmental friendly. But if we want to talk about the health benefits part, we all know that it helps the baby build a stronger immune system, and it helps him fight infections. And this is commonly known. But what's really magical about breastfeeding, that the protection it gives the baby is really also long-term. It's not just this short-term protection against illnesses. It really decreases the risk of obesity, diabetes. It protects about cancer, about leukemia, and it also reduces the risk of sudden infant death syndrome, asthma, allergies. And on the other hand, it promotes his development in the best way possible. So they would need less orthodontics, they would have less speech problems because they would have a better oral development, and they actually score higher on IQ tests. And these are just the highlights about the benefits. There are really a lot more. But what's really nice is that breastfeeding is not just beneficial for the baby, it's extended beyond that, and it really impacts mother's health as well. It's very important in the postpartum period because it reduces postpartum bleeding and postpartum mood disorders, but it also provides long-term benefits such as reducing the risk of breast cancer, ovarian cancer, as well as osteoporosis and diabetes. And it has some nice benefits, like it might help some women lose the pregnancy weight that they gain. And I like to include this picture just to see that breastfeeding really works and on each and every little part of baby's body to promote the health and development. And at this point, if women are still wondering, what if I can't make it? What if I don't have enough milk? What if I can't breastfeed? So just to boost women confidence and to make them believe in themselves a little more, I'm gonna go over quickly about the milk production, and it actually happens on 3 stages. The first one begins in pregnancy, and this is why the progesterone is this is when the progesterone is very high, and it plays a huge role in breast development, and this will prepare the breast for lactating at birth. And women actually notice that. They notice the increase in breast size during pregnancy. And in addition to that, colostrum, which is the first milk, is produced also during pregnancy between the 16th and 22nd week. And some women can actually have colostrum leaked or might be able to express it, but it needs a special technique. So even if women can't express the colostrum, they should trust that it is actually there and it is available even if they deliver prematurely. So the idea behind having milk ready in the middle of pregnancy is actually having milk available even if for some unknown circumstances we have to deliver before term. And we move then to the second stage of milk production, which is at birth. And this is when the progesterone, the pregnancy hormones, really drops down, and it gives the opportunity for the prolactin to level up. And this stage is automatic. So at this level, breast milk production will happen on itself. Whether we breastfeed or not, we will have milk produced. So after this stage only lasts for the first couple of days, and after the first week, we're gonna move totally into the third stage of milk production. And this is the tricky part, because this one is completely dependent on us and the baby. The third stage of milk production is actually ruled by the supply and demand process. And I'm going to explain a little bit about this process. So this stage is not automatic anymore. This is what I like to call a manual stage. This is when the baby suckles at the breast and removes the milk. When he empties the breast, our body will pick up the signal, oops, I need more milk, and it will start producing milk for the baby to be ready during the next feed. So the more the baby demands the milk, the more the supply is increasing. And for whatever reason, if a mom decides to reduce the frequency or reduce the time of the breastfeeding session, my body will pick up the idea that I don't need the milk that I'm producing, so I'm not going to produce it anymore, and will enter the weaning process. So it's very simple. It's a very simple equation. It's simple. It's a simple demand and supply process. And this is actually how our body works to produce enough milk for twins or for triplets, because this is how our body picks the signal. You know, we have twins, we have an increased demand, we should increase the supply. And this is really amazing, because our body produces milk, and it's really something that is readily available, and we just have to trust nature and how it works. So just to give you a boost, and what's really important to do in order to succeed in breastfeeding, it's actually to pay attention to the golden hour and to initiation of breastfeeding. The golden hour is the first hour after birth, and it's very important to initiate breastfeeding during this hour. It's important to start with some skin to skin and immediately to breastfeed afterwards. And I love all the talks that were shared in this webinar, because we really talked about natural birth, about dimmed light, freedom of movement. So the more the birth is natural, the more the baby and the mother are actually comfortable with breastfeeding and with this relationship, because nobody is actually staring at them. So they have the time to get familiar with each other. So once we put the baby skin to skin, we have to attempt the first breastfeed. And I'm gonna tell you why this golden hour is really important. So the golden hour really starts with 9 stages for the baby. It starts with the birth cry, followed by relaxation, then awakening, and then some activity. So the baby might try to massage their area, maybe some hand to mouth activity, then he will rest, then he will have a little bit of activity more, then some rest. So it's really an alternation between a little bit of activity and rest. And once he is ready, he will pick himself up and start crawling towards the breast, and he will be guided towards the breast by the smell and by the shape of the areola that has the shape of a bullseye. It becomes a lot darker during pregnancy. So he will be guided towards the breast, and he will start crawling towards the breast. And once he reaches the breast, he will start familiarizing himself with the breast by touching, licking, rooting. And once he's ready, he will start suckling, and he will actually self-attach to the breast and start suckling to have the first feed. And these stages are actually usually followed by a long phase of sleep. And once the baby reaches the sleep phase, and this actually happens after 60 to 70 minutes after birth, but once the baby falls asleep, some babies are really difficult to arouse. So if the mother is in a hospital setting and she missed the golden hour and the baby entered the sleep phase, the hospital will put some pressure on her to give formula, because it's very difficult for the baby to arouse at this stage and to attempt breastfeeding, which takes a lot of effort and energy. So this is why it's important to take advantage of this golden hour and this window, and to start breastfeeding during this time. So just to recap, to have a good start, we should include breastfeeding in our birth plan. So when we imagine how our birth should be, we should always think about skin to skin and about breastfeeding. We should ensure immediate skin to skin contact after giving birth, and initiate breastfeeding as soon as possible, and preferably during the golden hour. And we should always keep the baby and the mother together, even now in COVID. We should, of course, avoid giving pacifiers, bottles, or formula. And the golden rule is to breastfeed on demand, and that's it. That's whenever the baby wants. Thank you.
Thank you so much, Doctor. It was nice and fantastic presentation. Actually, we believe on that, and we like all of our team. They do take care of this breastfeeding, the most important care at the time of the birth. Thank you so much.
Thank you.
Thank you. Any more questions?